I can teach you exactly how to work with your pelvic floor to allow for a more effective push that hopefully is less traumatic for your perineum. There is like a more gentle pelvic floor way to do it, and then there's like a less gentle breath holding, purple pushing way to do it, which is how it's generally cued in the delivery room.
Welcome to Cycle Wisdom Chats, where we have deeper conversations about fertility awareness, women's hormonal health, and cyclical living. I'm Mary Aline, your certified fertility awareness educator, and today our expert is Dr. Seher, who is a pelvic health physical therapist that specializes in care for postpartum recovery and women's health. Welcome, Dr. Seher.
Thank you so much for having me, Mary Aline. I'm excited to be here.
Today, we are talking about prepping the pelvic floor during pregnancy. So, why is pelvic health and pelvic floor therapy important to do during pregnancy and after birth?
When people think about pelvic floor rehab, it's usually a postpartum consideration, but there's so much you can do for your pelvic floor while you're actually pregnant in order to make the pregnancy itself go better, in order to reduce any unnecessary trauma to the pelvic floor and the perineum, to make sure that your abs are coordinating properly. And all of that helps with the postpartum outcomes. Birth prep is kind of what we call it, or it's just this concept of taking care of your pelvic floor while your pregnancy is progressing, because no matter what, and really no matter what type of uh, delivery you have, whether it's C-section or vaginal, your pelvic floor has to withstand a lot of demand. The more and more pregnant you get, there's a lot of changes happening in your body, and the pelvic floor has to really adjust to those big changes. Pelvic floor physical therapy during pregnancy is there to help support these changes and to help, make you feel better in your body so that pregnancy goes smoothly and the postpartum outcomes go smoothly as well.
I mean, I can only imagine how much the pelvic floor is impacted by that big old baby that's
Yeah.
pushing on it while it's
Mhm.
growing. At what point does somebody want to start pelvic floor therapy after they find out they're pregnant?
For the most part, second trimester onward is going to be more helpful. But second trimester onward is when we start to maybe see some symptoms if there are symptoms. But let's say someone is completely asymptomatic and they're just having a really good pregnancy. There's no signs of like urinary leakage or pressure or pains in the body. Then even them, they can still come in at the second trimester just to understand what the pelvic floor is, how to activate it properly, how to breathe with it, and start to build these mechanisms so that as the pregnancy progresses and as the pelvic floor has to change and adjust, they already have a baseline understanding and a baseline connection to the area. And then third trimester is really when birth prep becomes really important. So people are coming in more often, even if they don't have like an active issue or an active symptom.
And I'm wondering how quickly should somebody come in after they give birth?
My philosophy on that is it really does depend on the person. I actually like waiting for the 6 week mark. There is variability with that, and I'll explain my reasoning. So, after the 6 week follow up with your doctor, when you are cleared for everything, then you can come into pelvic floor PT and we can kind of do all the internal work without having to worry about any side effects or anything like that. And we can really just dive into the healing process. This is assuming that you came to me during your pregnancy and
Mm.
I prepped you for the first few weeks postpartum. So typically, I leave my clients with like, here's what you're going to do the first 2 weeks postpartum, because it's just simple exercises you can do to connect with your body that I don't really think you need to fully leave your house and come to a session. Maybe we can do a virtual session. For most people, the first 6 weeks, I usually try to prepare them and give them some stuff to work on. And then at that 6 week mark, we get to do internal work. We get to really dive into treatment. I have had people who maybe they had like a more complicated delivery or they need more support come in at around the 4 week window for some support. And at that 4 week mark, we don't do internal work, but there's plenty of other things we can do and other things we can assess.
Can you tell us a little bit about what the birth prep looks like?
The prenatal visits with the doctor, right? They're super important, but they're not the same as function as of pelvic floor function and like
Mhm.
preventative care. So some things that we do for birth prep, like first and foremost, the most important thing is breathing and understanding how to connect and relax your pelvic floor. We're teaching the brain how to connect with the pelvic floor and be aware of these muscles, But the most important thing is that relaxation piece. Like, how can you breathe to allow these muscles to relax and open? Our body
Mhm.
naturally, reflexively wants to clench, especially when we're stressed. So, a lot of what we do in birth prep is just connecting and understanding how to override that stress response, that instinct of clenching by surrendering and releasing.
Oh, I that is so helpful. And I think as somebody who has a tight pelvic floor,
Yes.
I can imagine how supportive that is when the body is going through such tremendous amount of contraction and expansion.
I don't want people to immediately associate pelvic floor PT with internal work only because there's so much we can do without internal work as well. So, internal work is when we are physically inserting one finger into the vaginal opening and we're directly working with the pelvic floor muscles. And what we can do is we can release the muscles, just like you would massage any other body part. There are trigger points and knots, these areas
Mhm.
of hyper irritation, of hyperactivity that happen within the pelvic floor, that if we can release those areas, it allows the entire muscle to function better. It brings better blood flow, better oxygen. It allows for better range of motion, which of course is going to allow for better contraction as well. We breathe in a way that helps the pelvic floor relax. It's actually a very subtle relaxation that not many people can pick up on. I can tell you every time you breathe, this is what's happening in your pelvic floor, or this is actually how you breathe or how you push down to make sure your pelvic floor is relaxed. So when we're able to get internal, we can give that like real-time feedback and then adjust the cues accordingly. So I find that it's really, really helpful.
I can imagine how doing that internal work can really help accelerate that level of awareness and body perception. A lot of birthing people are worried about tearing. So I'm wondering if the birth prep also supports with potential tearing or how it can support with that.
Up to 90% of vaginal births are going to end up with some kind of perineal trauma, some kind of perineal tear. So sometimes it just happens, and there's so many variables for that. Genetics can be one where you're just more genetically inclined based on how your perineal body is positioned. So the
Mm,
space between the vagina and the anus, like the longer that space is, the less likely you are to tear. The shorter it is, the more likely you are. And the likelihood of a first and second degree tear is already pretty high anyways. So what we like to say with pelvic floor PT is our goal is to minimize the risk of tearing. We can never guarantee that it's going to be prevented, but we can minimize the risk of a third or fourth degree tear, which are a lot harder to recover from because they're tears that go down into the anal sphincter. First and second degree tears, people do really, really well with. So some of the things that we work on is honestly that piece of awareness. So being able to relax the perineum, right? Because when the baby's coming out, if it is a vaginal delivery, the perineum really has to stretch and expand. So if we have done the work during pregnancy to learn how to expand that area, learn how to surrender it, if we have done the work to actually relax the internal pelvic floor muscles, then the
mm,
perineum is going to have less tension on it. So hopefully the idea
mm,
is the perineum is going to be able to stretch and expand more. There's
mhm.
other things we can do, like perineal massage, which research shows that doing that during pregnancy it's helpful for mainly first-time moms, not as much for second or third-time moms, just because they're less likely to tear anyways. But building that awareness of like the perineal area is just so helpful, and getting that area to just stretch and relax over time is super
Mhm.
helpful. And then, of course, there are certain pushing strategies of like how the birthing person can push in order to reduce that trauma and that tearing. And that's something that I feel super passionately about teaching people,
Cool.
because there is like a more gentle pelvic floor way to do it. And then there's like a less gentle breath holding, purple pushing way to do it, which is how it's generally cued in the delivery room. Because there's just less nuance when you're learning it for the first time while it's happening. But the beauty of pelvic floor PT is we have time. We work together for an hour. There's time for all the nuance. I can teach you exactly how to work with your pelvic floor to allow for a more effective push that hopefully is less traumatic for your perineum.
Well, that's super helpful. Didn't even think about that, like different ways that we can push is going to affect our body differently, obviously. Duh, that makes
Mhm.
sense. But I just had never
Right?
really like put it together. So that's great that you can do all of this in a birth prep situation. How pelvic floor therapy differs if somebody has a C-section versus a vaginal birth?
It does depend because sometimes if it's like an emergency unplanned C-section, sometimes people do go through the pushing phase and then it's just not working out and then they have to get a C-section. You pushed and there was already that stretch in that for lack of a better term, that trauma or that injury to the pelvic floor. And then now we also have a C-section to recover from on top of that. So in that case, it ends up being a little bit of a longer process. We have to address the pelvic floor and the C-section scar and the abdominal strength and all of that. Now, in the case where like there wasn't as much perineal trauma and we just had a C-section, people, that's a common misconception that your pelvic floor is not affected at all. Keep in mind, so internal work is when we are physically inserting one finger into the vaginal opening and we're directly working with the pelvic floor muscles. And what we can do is we can release the muscles, just like you would massage any other body part. There are trigger points and knots, these areas
Mhm.
of hyper irritation, of hyperactivity that happen within the pelvic floor, that if we can release those areas, it allows the entire muscle to function better. It brings better blood flow, better oxygen. It allows for better range of motion, which of course is going to allow for better contraction as well. What I find is when people come in post C-section, their pelvic floor tends to be really sensitive and tight, actually, because it's
Oh,
trying to make up,
interesting.
yeah, which is
Yeah,
so
I would
interesting.
have thought the opposite. Yeah.
Yeah. And it's because if you had a C-section, your abs are so inhibited afterwards that the pelvic floor will kind of take
Oh,
over and it will guard
compensate.
up. And
Okay.
again, like a C-section scar, right? It's an injury to the body and our body responds to injury by tensing up. So a lot of times people with C-sections, they will have like trouble with intercourse, pain with sex. So they're like, and it's confusing because it's like nothing happened down here. So why does this hurt? But it's just like this compensatory effect from the C-section. We do dry needling, we do scar tissue mobilization for the C-section scar, but we have to do a lot of pelvic floor release work. So they still do a lot of internal work as well.
Hmm.
And on the other end, people who had a vaginal delivery, at the same time, we're still working on the abs. Like it's all really related, but there's not as much of that element of like scar mobility and compensation and all of that. So sometimes it's a little bit more straightforward.
Oh my gosh, we're getting like so much information packed in. I
Right?
love it.
Yeah,
And,
it's
and if
good.
you have been getting value from this video, please hit the like button and share a comment about any aha moment that you've had from this episode so far. So, my next question is if somebody chooses not to pursue pelvic floor therapy, or maybe they just haven't heard about it before, what are some of the negative or like the downsides that the symptoms that they could be experiencing postpartum with after a C-section or even just after vaginal delivery?
Any type of urinary leakage. So, super common myth. Once you have kids, you're just destined to leak every time you cough or sneeze or run, or like, oh my gosh, a mom's worst enemy is a trampoline. Like,
Yeah.
when you get to the age where your kids are jumping on trampolines, you can't join them because you're going to leak, right? So, that's something we can correct. And I will say to anyone that's listening to this, you could be 20 years postpartum and still heal from urinary leakage. Pain with sex is a huge one. Postpartum, if you're having difficulty with penetration or any sexual activity, that's something that we can correct. Another one is prolapse. So prolapse is also a common, to some degree, it's a really common thing that can happen after vaginal delivery, and that's when the organs are descending down. And that can feel really heavy. It can feel like a lot of pressure. It can feel like bulging. And there are
Mhm.
ways we can mitigate those symptoms. So if you have prolapse postpartum or during the early postpartum phase when you're already at like an increased risk of prolapse,
Mhm.
it's really important for you to understand the pelvic floor, understand how to exercise with it, how to move in your day-to-day with it so that those symptoms don't become everlasting.
So you have a upcoming course offering that I would love for you to talk about and also how people can work with you. So Dr. Seher is based in Denver, Colorado, and you also offer telehealth consultations.
It's just a comprehensive course for anyone who is not maybe able to go in to a pelvic floor physical therapist, something that's just meant to be accessible, self-paced course that, in my opinion, covers almost everything for a pelvic from a pelvic floor standpoint for preparing your body for pregnancy and birth, and understanding self massage, self mobilization techniques to work with your pelvic floor, certain breath works, and certain supportive exercises to work with the pelvic floor, along with a bunch of information about like labor and how to push properly, birthing positions, things like that.
Beautiful. And all that will be linked in the show
Thank
notes.
you.
And just want to thank you again for sharing your expertise with us today and just appreciate the work that you're doing in this world.